Industry press releases of pivotal clinical trial data that translate into market changes or approvability of a drug are often spun in a positive way. One common statistical ploy is to use the relative risk or ratio of outcomes and then hide the actual absolute difference between placebo and drug. Our recent story on the Avastin breast cancer data focused on this. We recently interviewed Dr. Norton Hadler on this subject.
The understanding of the difference between relative risk reduction and absolute risk reduction is critical if we're going to demedicalize the United States of America, and it's critical if we're going to effectively teach bedside medicine. I'm not the only one who feels that way. The editors of the major medical journals have decried the use of relative risk reduction in abstracts, in introductions, and in discussions. Of course, they have decried it, but you can find relative risk reduction in every issue of every major medical journal. Relative risk reduction is a meaningless number unless you know the absolute risk reduction. For example, let's go back to our discussion of cardiac disease. It turns out there has been an impressive change in the natural history of ischemic cardiac disease. My chance of having a heart attack at my age is about 35% less than my father's was when he was my age, and if he had a heart attack at my age, his 5-year survival was 50%. If I have a heart attack today, my 5-year survival is 96%, and that's with no medical interventions or interventional cardiology. If I take a baby aspirin post myocardial infarction, I will raise my 5-year survival from 96% to 98%. That's a 2% absolute reduction in survival at 5 years, which I actually consider at the cusp of being a meaningful therapeutic event. However, if I tell you not that it's a 2% absolute risk reduction, but a 50% relative risk reduction, it will sound far more impressive and far more likely that anyone will take the baby aspirin following their first heart attack. 50% reduction in mortality is a relative risk reduction, whereas 2% reduction is what's important. And if we actually went about the business of explaining absolute risk reduction, we would have far more people leaping to take statins and the like.